السلام عليكم ورحمة الله وبركاته. اليوم المحاضرة نكمل بها antimycobacterial drugs. The second line drugs or alternative drugs used for tuberculosis. The alternative drugs listed are usually considered only in case of resistance to first-line agents, in case of failure of clinical response to conventional therapy, also in case of serious treatment to limiting adverse drug reaction, when professional guidance is available to deal with the toxic effects. Ethionamides is a structural analog of isoniazide and also blocks the synthesis of mycolic acid. Its act also against extra and intracellular organisms. Available only in oral form. Metabolism is extensive and excreted through urine. It is poorly tolerated because of, first, intense gastric irritation, which is a very good, important side effect because of long term of treatment. Neurological symptoms and hepatotoxicity. Hepatotoxicity also, it's very important because most of anti-TB drugs has a side effect, hepatotoxicity with long-term treatment. Macrolides, azithromycin and clarithromycin are part of a drug combination that include ethambutol and rifampicin, used for treatment of infections by Mycobacterium avium and intercellulary complex. Azithromycin may be preferred for patients at risk, greater risk for drug interactions. Azithromycin is preferred especially in HIV-infected patients because it does not interfere with the metabolism of antiretroviral drugs. While clarithromycin, semisynthetic macrolides antibiotic that reversible binds to B site of 50S ribosomal subunit of susceptible organism and maybe inhibit RNA-dependent protein synthesis. It is distributed widely in the most body tissue except cerebrospinal fluid. عندنا الكابريومايسين antibiotic obtained from Streptomyces species. Mechanism of action, it is a peptide protein synthesis inhibitors. Cabiriomycin is an important agent for treatment of drug-resistant tuberculosis strains of mycobacterial tuberculosis that are resistant to streptomycin and amikacin. إذن عندنا الكابريومايسين هو alternative للستريبتومايسين and amikacin. The main adverse effects similar to macrolides or aminoglycosides, nephrotoxicity, ototoxicity, and local pain and sterile abscess due to injection. Cycloserine is an antibiotic produced by Streptomyces species. Mechanism of action inhibits incorporation of D-alanine into peptidoglycan pentapeptide in the bacterial cell wall. By irreversible inactivation of the enzyme alanine racemase. Cycloserine used widely to treat tuberculosis caused by Mycobacterium tuberculosis resistance to the first-line agents. Adverse effect: first, CNS disturbances, which include lethargy, difficulty concentrating, anxiety, and suicidal tendency. May also seizure may occur. The second drug, amino salicylic acid, It is structurally similar to para-aminobenzoic acid and sulfonamides. The mechanism of antibacterial action of aminosalicylic acid is similar to that of sulfonamides. It is a folate synthesis antagonist that is active almost against Mycobacterium tuberculosis, used infrequently because other oral drugs are better tolerated. يعني ممكن نستبدله لانه سايد افكت وممكن اكو ادويه افضل من عنده. الادفيرس افكت بابتيك ulceration and hemorrhage may occur، وهي هاي المشكله عندنا هاي لانه التريتمنت بالتي بي هي لونج تيرم، فهذا اللونج تيرم اللي قد يمتد الى سنتين ممكن يسبب لي اي اشكالات بالمعده، ممكن يسبب لي في الكومبلينس ديكريز or change in compliance of the patient and also to يعني نسوي بدائل للاورال administration drug نسويها بالانجكشن. Peptic ulceration and hemorrhage may occur. Hypersensitivity, fever, joint pains, skin rashes, hepatosplenomegaly, hepatitis, adenopathy, and granulocytopenia often occur after 3 to 8 weeks of aminosalicylic acid therapy. عندنا الكاناميسين and amikacin. Kanamycin has used for treatment of TB caused by streptomycin resistant strain. The role of amikacin is in the treatment of tuberculosis has increased with increasing incidence and the prevalence of multi-drug resistant tuberculosis. Semi-synthetic macrolides antibiotic that reversibly bind to B sites of 50S ribosomal subunits of susceptible organism may inhibit RNA, DNA, protein synthesis. Kanamycin resistance often indicates resistance to amikacin as well as auditory toxicity more occur with kanamycin than with streptomycin and capreomycin. إذا عندنا الكاناميسين الاوديتري توكسيسيتي يعني عندنا اللي يأثر على السمع أكثر من الستريبتومايسين والكابريومايسين. Rifabutin. It is derivative from rifamycin and is related to rifampin. It has significant activity against Mycobacterium tuberculosis. Because it is a less potent enzyme inducer, rifabutin is indicated in place of rifampin for treatment of tuberculosis in patients with HIV infection. هاي كلش مهمة لأنه ما يصير بها انزيم انديوسر، فلذلك ما راح تأثر على البقية يعني ميتابوليزم مع البقية الدراجز، خصوصا جماعة الايدز اللي يحتاجون أدوية اللي تقل مناعتهم فيصابون بالتي بي، فيحتاجون أدوية للإنفكشن مال التي بي ويحتاجون أدوية للريتروفيروس. Rifabutin is effective in prevention and treatment of disseminated atypical mycobacterial infection in AIDS patients. Rifabutin is an analog of rifampin. It is active against both Mycobacterium tuberculosis and Mycobacterium avium and intercellular complex. As with all rifamycins, it is a bacterial RNA polymerase inhibitors and the cross resistance between rifampin and rifabutin is complete. A potent enzyme inducer, metabolic enzyme inducer, should not be used to treat patients with HIV infection. يعني rifabutin هي specific for HIV patient, while rifampin they are not used in patient with HIV infection. Rifaximin Purely non-systemic rifamycin approved for traveler's diarrhea, hepatic encephalopathy, irritable bowel syndrome, small intestinal bacterial overgrowth, and Clostridium difficile infection. يعني ما يستخدم بالنسبة للسيستميك. Fluoroquinolones, aprofloxacin, levofloxacin, gefloxacin, and moxifloxacin inhibit a strain of Mycobacterium tuberculosis. They are also active against atypical mycobacteria. Levofloxacin tends to be slightly more active than ciprofloxacin against Mycobacterium tuberculosis, while ciprofloxacin is slightly more active against atypical mycobacteria. Fluoroquinolones are important addition to the drug available for tuberculosis, especially for strains that resistance to first-line agents. Resistance may result from any one of several signal point mutation in gyrase A subunit develops rapidly if fluoroquinolones is used as a single agent. Linezolid. Linezolid achieves a good intracellular concentration and it's active in Murines model of tuberculosis. Conversion of sputum culture to negative was associated with linezolid used in these cases, and some may have been cured. Significant يعني المهم أول شيء هو شو اللي إنه بالسبيوتم يسوي النيجاتيف الكالتشر يسويه نيجاتيف يعني ما تطلع بكتيريا بالسبيوتم وهاي مهمة يعني تساعد بعدم نشر المرض لأنه هو ما راح تطلع ويا السبيوتم ما راح تطلع ويا الإكزوديت فما ممكن يعني بالسكريشن فحتى العطاس السعال ما راح ينشر المرض. Significant and at times treatment limiting adverse effect including يعني ليش يصير بيها يعني limiting بالuse include bone marrow suppression and irreversible peripheral and optic neuropathy have been reported with the prolonged courses of therapy that are necessary for treatment of tuberculosis. عندنا الثird class of antimycobacterial drugs عندنا drugs active against atypical mycobacteria. Atypical mycobacterial infection include Mycobacterium canasazi, Marinium, Avium, and intracellular. Leprosy, prophylaxis of meningococcal and Haemophilus influenzae meningitis, methicillin resistant Staphylococcus aureus, diphtheroids, Legionella infection, along with the doxycycline first-line therapy in brucellosis. As a rule, these mycobacterial species يعني من general هاي mycobacterial species less susceptible than mycobacterium tuberculosis to anti-tuberculosis drug. يعني تشوفها اللي potent و effective against TB هو ما راح تشتغل هنا تصير resistance هنا يعني عندنا هي less susceptible than mycobacterium tuberculosis to ordinary anti-tuberculosis drugs. On the other hand, agents such as erythromycin, sulfonamides, or tetracycline, which are not active against mycobacterial tuberculosis, may be effective for infections caused by atypical mycobacteria. Emergence of resistance during therapy is also a problem with these mycobacterium species. And active infection should be treated with combination of drugs. يعني هنا بصورة عامة هي تكون قليلة يعني السسبتابيلتي مالتها few than to mycobacterium. يعني شلون المايكوبكتيريوم tuberculosis anti TB drugs. and بالمناسبة الثانية انه اللي المايكوبكتيريوم tuberculosis هي ريزيستنت للاريثرومايسين سلفوناميد التتراسايكلين، لكن نشوفها هي active against atypical mycobacteria. Mycobacteria canasazi is susceptible to rifampin and ethambutol, partially resistance to isoniazide and completely resistance to pyrazinamide. نشوفها هي اللي هي البيرازيناميد والايزونيازايد هي very potent anti TB drugs. نشوفها هي completely resistance اللي هم الريفامبين والايثامبيوتول هو يكون susceptible إليه. Mycobacterium avium complex, which includes both Mycobacterium avium and Mycobacterium intercellulare, is an important and common cause of disseminated disease in late stage of AIDS. Combinations of agents are required to suppress the infection. Azithromycin ممكن نعطي azithromycin or clarithromycin plus ethambutol is effective and well tolerated regimen for treatment of atypical mycobacterial infection. بالنسبة لي المايكوبكتيريوم انتي مايكوبكتيريوم دراجز بالكونكلوجن مالتها النتيجة مالتها نشوف انه initial 4 drugs regimen اللي هو ايزونيازايد ريفامبين pyrazinamide and either ethambutol or streptomycin is recommended for empiric treatment of tuberculosis. عندنا neither ethambutol or nor streptomycin adds considerably to overcome overall activity, but they are given in combinations to prevent emergence of resistance. يعني الرابع اللي هو الايثامبيوتول او الستريبتومايسين من ينضاف ما ينضاف حتى يزيد لي الاكتيفيتي، لانه الاي ان اتش والريفامبين البيرازيناميد هي كافيه للكيور اوف مايكوبكتيريوم. لكن عندي شنو؟ عندي اللي يخلونها حتى prevent emergence of resistance، يعني يكثر الاشياء ويحارب بعده ميكانيزم حتى يمنع الريزيستنس. An isoniazide rifampin combination given for 9 months while treated. إذا نستخدم الايزونيازايد ريفامبين كومبينيشن بوحدهم ممكن تستخدم ل 9 months will treat 95 إلى 98% of cases of tuberculosis caused by susceptible strain. The addition of pyrazinamide to an INH rifampin regimen for the first 2 months allows the total duration of therapy to be reduced to 6 months without loss of efficacy. يعني إذا نضيف الأيزونيازايد والريفامبيسين وبحدها 9 أشهر، إذا نضيف لها بيرازيناميد راح تختصر المدة الشهرين، راح تختصر الثيرابي تخليها 6 أشهر فقط without loss of efficacy. Multi-drug resistance organism resistance to both isoniazide and rifampin should be treated with 3 or more drugs to which the organism is susceptible for a period of more than 18 يعني 18 months. إن ممكن إنه إذا صار عندنا المالتيبل ريزيستنس للأيزونيازايد والريفامبين راح نشوف البيريود اوف تريتمنت تزداد إلى 1.5 سنة including 12 months يعني 1 year after sputum culture become negative. يعني عندي ممكن سنة كاملة عندما تطلع السبيوتوم negative. Mycobacterium avium complex is the common cause of disseminated disease in late stages of AIDS. Combination of drugs are required to suppress dissemination of the disease. Clarithromycin or azithromycin plus ethambutol, rifampicin, and or fluoroquinolones are added to above regimen in some cases. Drugs used in leprosy. Leprosy or Hansen's disease is a chronic human disease caused due to an acid-fast bacillus which produce nodules in the skin and loss of sensation in the affected region. This dermatological infection is caused by Mycobacterium leprae, and the disease developed very slowly over a period of years. Anti-leprotic drugs classification according to their chemical structure: السلفون, الدابسونز, الفينازين derivative, clofazimine, anti-tubercle drugs اللي هي ريفامبيسين, ethionamide, other antibiotics, ofloxacin, minocycline, and clarithromycin. Dapsone and other sulfones. Several drugs closely related to sulfonamides have been used effectively in long-term treatment of leprosy. The most widely used is dapsone. Dapsone inhibits folate synthesis similar to sulfonamide. Mechanism of action like dapsone-like sulfonamides inhibit folate synthesis, para-aminobenzoic acid antagonist, and bacteriostatic. Resistance can emerge in large populations of Mycoplasma leprae. Example, in Libromatus leprosy, if very low doses are given. Therefore, the combination of dapsone, rifampicin, and clofazimine is recommended for initial therapy. Dapsone may be used to prevent and treatment of pneumocystis pneumonia in AIDS patients. Kinetic. Sulfones are well absorbed from GIT and widely distributed throughout the body fluid. Half-life 1 to 2 days. The drug tends to be retained in skin, muscle, liver, and kidney. Skin heavily infected with Mycobacterium leprae may contain several times more drug than normal skin. يعني هو السلفونز يعني الدابسون ممكن يكون كونسنتريشن مالته عالي بالسكين والمصل والليفر والكدني. بالنسبه للسكين الانفكتد سكين يكون الكونسنتريشن اوف دراج more than normal skin. Excreted into bile and reabsorbed in the intestine. Excretion into urine is variable, and most excreted drug is acetylated. The adverse effect. The most side effect is hemolysis, especially in patient with G6PD deficiency, methemoglobinemia, GIT intolerance, fever, pruritus, and various rashes. Arrhythmia nodoseum leprosum develops during dapsone therapy of Libromatus leprosy, suppressed by corticosteroids and or thalidomide. Rifampicin, highly effective in Libromatus leprosy. The drug is given in combination with dapsone and other anti-leprosy drug. Because of resistance, the drug is given in combination with dapsone and another anti-leprosy drug. A single monthly dose may be beneficial in combination therapy. Clofazimine is a phenazine dye that can be used as an alternative to dapsone. The mechanism of action may involve binding to DNA. Its Rhodex property may lead to the generation of cytotoxic oxygen radicals that are toxic to the bacteria. يعني ما عليها لا بالسيتوبلازم ولا لا الممبران لا سيل ممبران ولا سيل وول ساينتيسز ولا الار ان اي والدي ان اي، مجرد انه راح يصير عندنا generation of cytotoxic يعني free radicals cytotoxic oxygen radicals that are toxic to the bacteria. It is bactericidal and to Mycobacterium libri and it has potential useful against Mycobacterium tuberculosis. Clofazimine has some anti-inflammatory and anti-immune activities. Thus, erythema, nodosum, librasomy, and do not developed in patients treated with this drug. Kinetic. Following oral absorption, the drug accumulates in the tissue, allowing intermediate therapy but does not enter CNS. Half-life 2 months. Adverse effect. Patient typically developed a big to brownish black discoloration of skin, eosinophilic and other forms of enteritis. Sometimes require surgery have been reported. هنا هذا الفيجر اللي فيجر مهم بالنسبه للانتي تيوبركلوسيس basis of multi drug therapy. وعندنا هنا الفيجر اللي يبين لنا السايت مال الاكشن mechanism of action of each drug. That's all and thank you for all.